Hi, I'm Graham from Match Medics and welcome to our podcast, Dr. Diaries, Adventures to Ireland, where each week we have a doctor come on to tell us their own personal story about relocating to Ireland. Great stuff. So thanks, Jason, for coming on to our podcast, Dr. Diaries, Adventures to Ireland. This one is slightly different for us in that we have a client coming on to talk about the overall services that your soon-to-be open brand new hospital in Limerick is serving quite a large, growing population in the southwest. So we'll delve into that a little bit later on. But first, can you introduce yourself, tell our listeners and viewers who you are and who you're representing here today?
Thank you, Graham. Thank you for the invite. So, Jason Kenny, I'm the hospital CEO for the Bon Secours Hospital Limerick. Have been for the last 8 years. So, the Bon Secours health system is a health system in Ireland, a private provider, Ireland's largest private provider of 5 hospitals and a care village nursing home in Cork. So, they acquired a hospital back in 2017 in Limerick called Barrington's. And Barrington's was a 48-bed independent surgical hospital that was owned by a gentleman by the name of Mr. Paul O'Byrne. Who unfortunately deceased at the time we were purchasing the hospital. So the Bonds took over that hospital back then with about 150 staff, 11,000 patient discharges, and maybe 45 consultants at the time. So last year, 7 years on, we went from 11,000 patient discharges to 24,500 patient discharges through the same 48 beds.
Wow. Brought
on an extra 35 consultants and 120 staff. So needless to say, we outgrew ourselves. So
sure.
We're delighted that in the next 3 weeks we'll be opening our brand new 190-bed hospital in Limerick, 3 miles from the existing one, but we can cover that, as I said, later on. So prior to that, I spent 31 years in hospitals, have all the signs of it at this stage, to be fair, and still learning about them on a daily basis.
Sure.
Prior to that, I spent 10 years in the HSE. I was a deputy group CEO of Cork University Hospital Group, which was 4 hospitals of CUH, the maternity hospital, Mallow and Bantry. Just over 1,200 beds, 4,500 staff, there for 7 years. Prior to that, I was a general manager and deputy general manager of Kerry General Hospital in Tralee, and prior to that, my background's in procurement. So a great job, spending all of someone else's money in a hospital, not knowing where it came from, but all jokes, great experience, buying products and equipment, and you meet all of the departments. And I suppose that's what got me into the whole general side of hospitals and healthcare, is meeting lab or catering or theatres, etc., and the wards. So hospitals, as I said, over 30 years. And I started off with when I was in college, and I was doing finance in college and some accountancy in terms of a locuming in the Sutton Fermy Hospital. So I don't think there's many hospitals in Cork, Kerry, or in Limerick indeed that I haven't worked in at this stage.
Yeah, and what a journey you've been on, both between public and private.
Yeah.
What, for you in that time that you spent across both, has been the biggest difference?
It's a very good question. To be fair, when you walk in the front door of the building, nothing.
Sure.
Healthcare, clinical standards, the standards of the staff and the consultants, you wouldn't know whether you're in public or private in terms of the care being given, to be fair. There is no doubt in terms of monitoring maybe efficiency or monitoring productivity and things like that. It does tend to be more focused on the private or voluntary side. But to be fair, we don't have some of the challenges that the public side have, which is more complexity invariably. They've also got a large teaching requirement. So that does tend to slow down lists. So, we might do 10 lab colis in a day in one of our theatres. We might do 6 in a public hospital, but they've got to teach the next generation. They've got to look after and the more complex patients, etc. So there's some differences like that.
Sure.
And the other main difference, to be honest, is that unfortunately I was in the health sector along back in 07, 08 with the financial crisis. So then you're reducing staff and not replacing them, and service didn't get done. And all of a sudden waiting lists would be produced, etc. In the private sector, we don't do waiting lists. You've got to get through the work. And if there is a waiting list, you open the theatres longer, you work on Saturdays, etc., to get through that waiting list. So there's certainly little challenges, but at the end of the day, clinical standard-wise, we follow very similar standards and quality guidelines that are being created with the national programs, etc. And I suppose, thirdly, which I welcome, in the private sector, we subject ourselves to international accreditation. So in the bonds, we have JCI, Joint Commission International.
Sure.
So every 3 years, they would visit from international. You could have anyone from around the world, clinical, nursing, administration, would come for 3 days onto our hospital and would assess us against a set of standards.
Okay.
Now, the beauty about this is it's not an exam per se. They give you the questions of the exam 3 years out.
Sure.
They give you what they expect to see in the book. The book is over 600 pages. And it's basically the how-to guide to run a hospital, the how-to guide in terms of policies and procedures. So every 3 years we, I use the word subject ourselves, we offer ourselves to that accreditation. And it's very good external validation as to the care we're giving has been validated to international standards. Again, public-wise, I'm not, maybe 1 or 2 hospitals may have that accreditation standard, but they follow the HICRA standards, to be fair, in the public hospital. So they're the little nuances, to be fair. But of course, the biggest one, which affects the main reason we're here today, is the consultants, is that 99.9% of our consultants are independent contractors.
Sure.
They're not employees of the hospital. Like when I was in management in the HSE, all of the consultants were employees of the hospital. But again, managing consultants or leading consultants, you have to be very, very conscious, and rightly so, of the clinical autonomy that they have, etc., in the medical council and whatnot. So a big, big difference in terms of consultants in the private sector being independent contractors. So basically, I would view the consultant through the lens that I am as a CEO of a hospital as my customer, as opposed to an employee. They're my customer, because without them bringing their patients to my hospital, we wouldn't have a hospital.
Sure.
So, and they need me to provide nurses and theatres and equipment and beds, etc. So it's a very symbiotic relationship it's in both of our interests to help each other in that way. So when you have an alignment of a common objective, lots of good things can get done.
Amazing. Yeah, and it's quite a crucial part to lean on, and that it is quite and it's personal, it is quite a relationship-based environment that you're in, both working alongside the public and the private system, because both have to be talking the same language in order to have ultimately the best outcomes for patients, whatever journey they might be going through within the health system. So you were very gracious and very kind to bring us down to see the brand new site down in Limerick a few months back, and we got to see firsthand how impressive that brand new setup is down in Limerick. Talk us through how that's going to transform delivery of healthcare in Limerick and the wider Munster region.
Yes, it's at the moment, as I said, we have a 48-bed surgical hospital. So we do no medicine, we do no cardiology or inpatient medicine or some semi-acute work. We do none of that. All our work is elective, and the objective of our hospital at this point in time is we close it at 3 o'clock every Saturday afternoon and reopen it at 6:30 on Monday morning, because all our work is scheduled. So, and in Limerick, there is no full-scale private hospital in Ireland's third largest city. Galway has 2, Cork has 2, Kilkenny and Waterford all have full-scale private hospitals. This is Limerick's very first full-scale. When I say full-scale, surgical and now medical. So we'll be opening our very first hospital access unit, which is akin to a medical assessment unit, where GPs can send their patients who are not too well there and then at that point in time. And that is a potentially nice alternative to potentially right now going to an emergency department in the region, or going to the other assessment units in the region. That there's an additional capacity being provided, not to the size of what's already in the wonderful University of Limerick hospital group service that they do provide, to be fair to them. But then again, complementary and additional. So we'll have a 10-bed assessment unit, and from there then we will admit patients for medical admission for our very first time. We'll be broadening the scope of surgical services in terms of that patients who are now, dare I say, that bit sicker with the medical backup can now come to our hospital as well. We're moving into interventional cardiology, which is fantastic for the region. There is no private interventional cardiology. Interventional vascular, expanding our orthopedic service. So there's lots of good things happening. Bed-wise, 48 up to 190, 99 of those are all single bedroom ensuite, all with a window view, whether north, south, east or west. And then the additional day beds and side room beds. The hospital 5 years ago, maybe 2 months during the horrible COVID times, to be fair, hard to believe 5 years ago, when we were walking many a sites around Limerick with the very good assistance of Limerick City and County Council, who were working with us and have worked throughout the last 5 years working with us, and without them and many other stakeholders we would not be where we are today, which is opening the hospital in 3 weeks' time. And 5 years ago we chose a site, and we purchased that site, 7 acres, and within 12 months of interviewing for architects and a project team, etc., over 24 different stakeholders. We had planning permission secured, all within 12 months.
Wow.
Probably twice as fast as you should normally get that.
Yeah.
Within 6 months, we had a builder, John Sisk and Son, and subcontractor Jones Group appointed. We broke ground in February of 23, 2.5 years ago, and we're opening in 3 weeks' time.
And do you think the accelerated timeline was prompted by the sheer healthcare need within the region?
Very good point. Two things. Absolutely, you don't go away and invest over 200 million in a building and in the service that we've done without doing some due diligence and checking the market. So we did external validation again of what is the market need and the market demand, and it was very strong, very, very strong. And says he's sitting here with an empty hospital that hopefully in 12 months' time will be full. I'm very confident will be. So yes, we did our due diligence. We looked at what specialties in particular are needed in the region, and we listened to our GPs. I mentioned earlier about the consultants being one of our customers. We actually have 4 customers. You think from my perspective,
Sure.
the patient as number one.
Yeah.
The patient is not able to come in without the consultant. The consultant can't see that patient without the GP. The GP sends the patients to the consultant.
Yeah.
And of course, none of them pay us except the insurance company.
Sure.
So VHI,
Yeah.
Leia, Irish Life and others are the insurance companies that contract us on behalf of their members to provide a service for them and then reimburse us for that. So we've got 4 customers that we need to look after in that regard.
Yeah.
So again, listen to them, listen to all our customers. What do you need? What do you think we should do? And there's some things that they ask for that we haven't put in for a variety of reasons. Number one, pediatrics jumps out as number one.
Yeah.
And we decided not to, rightly so.
What was the thinking behind that?
Rightly so, the national guidelines around if you treat a child under 16, you rightly need to have the infrastructural set up that they don't mix with adults. You need to have pediatricians, you need to have pediatric trained nurses, emergency pediatric trained nurses, etc.
Okay.
So it does become that bit more challenging to provide that if you don't have the numbers. Secondly, with the wonderful hospitals being built above in Dublin and that whole hub and spoke model of satellite centres, etc., that's the right place where all of the expertise for the most vulnerable in society would be taken care of. So it's not for us, to be fair. But again, clinical standards dictating it is better to be done in those areas.
Okay.
So that was one example.
Yeah.
Critical care is another example that right now we'll walk before we can run. We will not at this point in time, but hopefully we go well in time to come, we will expand into critical care.
Okay.
There is no doubt that our members, insurance members, our patients, etc., will require more complex intervention.
Sure.
And then require more high dependency care. We will have a high dependency level within the hospital, but not to the critical care level. And in years to come, we hope to develop that as well. So this is, dare I say, phase 1 of a number of phases.
Yeah.
And like everything in healthcare and in hospitals, you're not finished at the end of the week or the end of the month.
Sure.
It's continuous. It's continuous quality improvement, it's continuous development, it's continuous investment. It just keeps going and going and going. And it's about managing and leading that in increments that don't break the whole system.
Okay.
So, big day for us in 3 weeks' time. It was a big week for us this week in that we got formal certification of phase 1 of our hospital from the council, etc. So it's all systems going now. We've got live simulations happening next week and training and stocking of wards and stocking of units, all getting ready to welcome our first group of patients on Monday the 15th of September.
Wow, okay.
And then the second phase will be on Monday the 29th of September, where we're also not just opening a new hospital, we're transitioning and relocating the existing staff, the existing team from Barrington's.
Right.
So there's 260 of those people who helped to get us to where we are today. And we're bringing on board another 200 people on top of that. So there's the existing team and the new team, all to be brought together, all to be transitioned over. And we'll be running 2 hospitals for 3 weeks together at the same time.
Wow.
But not the same service. So endoscopy will be in Towlerton and surgery will continue in Barrington's inside the city centre.
Okay.
So lots going on, but the joys of allowing me to be up here with you on an afternoon and not to be hugely worried about what happens back at base. It's because we've got a great team. It's a massive team in terms of their professionalism and their dedication to this project. The show goes on, whether I'm there or not, and it's very much welcome. It's down there this morning for a few hours and on site meeting the team, and tension is building, but in a good way.
Yeah, and let me ask then, what's the local community's reaction been to this build up? Finally, they've seen this field for however many years. They've seen the bricks go up, and now we're coming close to opening day. What's that been like?
I'm a Cork man, as you can tell from the accent. I live in Cork, but I meet a lot of Kerry people and people driving past, and there's certainly a wow factor. I think the design of the building lends to that. It's a rather unusual crescent-shaped design, and to be fair, 3 years ago, listening to our architects, Reddy, Urbanism and HOK, who were excellent, absolutely superb on this, and the ideas around why they chose that design, and going around Limerick, spending a few days around Limerick, and Limerick has a few crescent-shaped buildings, and some areas in it are called Crescent, and O'Connell Avenue is crescent-shaped buildings, and they brought that in, this welcoming. So that's the very first thing people say, what a building, looks beautiful, etc. And then what's going to be in it in terms of what services, etc.
Sure.
There's great excitement, but at the same time, up to recently, tinged with a touch of let's wait and see. They've been close before and getting hospitals, etc., and it has never happened before. So this is the first one in Limerick, and not only that, it's probably the first full-scale hospital to be built in Ireland in over 20 years. So we don't take that lightly. And when you're building a hospital in 2025, it's so different from when you built it 30 years ago or 40 years ago. The technical standards are different and the requirements are different. So when you walk around, this hospital just looks and feels different in size and scale, etc. So it's humbling, but at the same time, we're confident that the people of Limerick and the wider Midwest will support this hospital. But we can't assume that. We've got to get the best of consultants, the best of staff to give that caring, welcoming feel and hospitable feel for our patients, and then word will spread. In true Irish way, word will spread. The marketing in terms of this will market itself. When people talk about it, I had a great experience in there. That's all you need to be said. That's what we strive for. Great.
And we talk about getting the right people, getting the right fit. What's been your team's vision there in terms of getting you can find a surgeon, all right, but if they're not the right mentality, if not the right personality to come into such, as you say, like a national project as it is, or national first, what has been the criteria that you and your team have been looking out for, yourself and Siobhan Grimes and the likes?
It's a great question, to be fair, a very good question, and it is slightly different for the medical side, to be fair. To me, when you get to the stage I'm at, give me personality all day. And then, of course, competence thereafter. But if you've got the right attitude and the right, dare I say, cultural fit, and people use the word culture very loosely, and like to me, quite simply, culture is how do we do things around here? We do things in collaboration with a multidisciplinary team. It is not all about you. You might like to think it's about you. It is not all about you. You are part of a team. You might be the leader of the team. You might be another element of the team, but it's a team effort. And if you don't respect the team, if you don't respect the colleagues, well, no, I'm sorry, that's not, no matter who you are, that won't be put up with at all. Vice versa, it won't be. So to me, collegial collaboration, and that is the engine oil then, that rubs off and feels on the patient. The patient can pick up on tension, the patient can pick up on various aspects of culture, so make them feel relaxed. They're handing themselves over to us when they walk in those front doors of the building. I've spent many years walking hospitals, and patients are frightened, to be fair to them. And the last thing they need is to feel tension from caregivers. Go around with a smile, go around with and they take as a given the clinical competence of the person we brought in. So of course we look at the competence, etc., but very much around personality, very much around, I won't say you have to be an innovator, but like it would be great if you also wanted to contribute to our project, contribute to the direction of travel we're going, and not just be, dare I say, a consumer of the service. Yes, you're a customer of the hospital, bring your patient in, do your work, gone. Some people like to do that, that's fine too. But I'd like to have a mix of people who have a bit of pride in the building as well, have a bit of pride in the organisation, would like to contribute how to better the overall organisation. An element of that would be helpful as well. Not everybody, to be fair, not everyone wants to do that or can do that. So that personality of collegial, a bit innovative, and indeed also good work ethic. At the end of the day, there's a correlation between safely, the number of patients we look after and treat is aligned in that regard. But of course the starting point is me sharing that vision from the outset with the consultants and the medics coming in, and quite quickly they will let me know if that aligns with their own vision, and if it does, that's the starting point.
And when we talk about relationships as well, Limerick University Hospital has, we have to say, a reputation, and no doubt this service is going to give not only capacity, but much more of an arm wrapped around their services to be able to give the wider population in the area greater access to care. But how have you and your team found that relationship building with, well, no doubt, stakeholders you've dealt with over the years, but operating in a private space, some might perhaps be, dare I say, territorial over their specialty. How have you found that sort of balancing act with personalities both in public and private?
Again, very good point, Graham. To be fair, it's like I spent 23 years in the public sector. There is lots of fantastic stuff being done in every public hospital, including University Hospital Limerick. I like to think, have already an existing good relationship with Limerick and the region. We like to and need to and wish to contribute to the public waiting list. And there are initiatives out there, be it locally or be it National Treatment Purchase Fund, etc., that we would take on long waiters and assist with the public sector. So elements of our work, and our consultants are asked to also add some public patients on a waiting list to help the local hospital. Absolutely. And it suits us as well, obviously, to bring in some activity in that regard.
Sure.
We have consultants at the moment working with us, a lot of excellent consultants here for many, many years, who work both in Limerick and in the Bonds. And that is a very nice relationship, because at the end of the day, they straddle both organisations, and they can decide that if a patient is in needing of a more complex intervention, they go through the public route. But at the same time, if they have a private patient that they can treat in our hospital, it creates space on the public waiting list in the public theatres to be treated in the public hospital. Some consultants choose to be full-time private. That's their prerogative. Some consultants choose to be part-time private, part-time public. That's their prerogative. We don't start by saying we want X number of full-time private, we want Y number of joint contract holders. Whatever turns up in the linking to the specialty that we have, that's what we'll do. Of course, nationally with Sláinte Care and public-only consulting contracts, that has changed things quite dramatically.
Sure.
Being honest, in Limerick, not massively.
Okay.
Not massively.
No, the uptick hasn't been as strong elsewhere.
I believe in pockets of different parts of the country it's been strong, it's been higher in certain areas. I haven't seen it, to be honest. Also, like, we're recruiting an extra 250 staff, and lots of people potentially fearing that there'll be a drain from the local public. Haven't seen that either.
Okay.
Absolutely not.
So is it more, if you could pinpoint it, has there been, what's the mix between international talent and local talent that have come your direction? It's
like I suppose 3 pockets. You've got local team members coming aboard, absolutely. You've got national people coming back to Limerick from Dublin or Galway or Cork, etc., and you've got international. But it's certainly the international not as high as I thought we would need.
Sure.
Now, we're not finished. We're probably still another 25% to go in the recruitment side, because it's not like we're not going to have everybody ready for day one.
Sure.
To be fair, and it wouldn't be right. Bring people on, like big bursts, bring people on, and then we'll be recruiting over the next 12 months, over the next 12, 15 months. And that's both for doctors, consultants. This isn't let's get everyone in here by the 1st of October and we're ready. I'm meeting people that will come join us in 2027.
Okay.
And that's what we need to be thinking that far out as well. So, no, it's the Irish market, as you well know, to your area as well, is, it's people will decide. And even when they do turn up for an interview, and even they do say that there's no guarantee until they sign the contract.
Yeah.
There's no guarantee. Back in my day, it's just when you turned up for an interview and went and said yes, off you go.
Yeah.
But
and certainly times have changed around that piece. And I wonder, everyone talks about when it comes to medical talent, whether it's doctors or nurses or OTs, and that younger talent is going overseas. Have you found with this quite unique hospital project that is attracted returning Irish?
Absolutely.
Yeah.
Absolutely. And what we're also hearing, only in the last week or two, we had a very good conversation with Director of Nursing and Head of HR, Bernadette and Yvonne, last Monday, and some of those who have returned are in contact with their colleagues back in Australia or North America, saying, it's this or it's that, and there's an element. So we're now seeing a pickup of a kind of internal referral
Sure.
from their
Yeah.
colleagues, and they sent out. There's always early adopters. There's always
Yeah.
or adopters. There's also then the next group that come along, that whole bell curve.
Sort of
So
word
yes,
of mouth.
we're
spreads
absolutely,
quickly,
and look, like word of mouth can be, they're probably communicating, they're probably not talking to each other, they're probably communicating through some media app or something, but absolutely, and that is, and there's also a touch, without being a psychologist, that people want to wait till the building opens.
Sure.
People want to wait till it gets settled and then potentially look at their options next year.
Yeah.
And that's across all categories of staff, to be fair.
Okay.
And I include consultants in that,
Yeah.
and medical doctors, etc. Absolutely. And again, that's understandable. That's
Yeah.
very understandable. I can't be assuming that we've got the same type of person who will act the same type of way. We are people in the service industry treating people. We're not making machines or widgets, etc. So when it comes to people, you've got to recognise people's personality, and everyone is different.
Yeah. Tell us then about, we're talking about future proofing, we're talking about planning ahead, not just building a hospital for 2025, building a hospital for the future, and I think that's possibly one of the other differences between public and private, and that might be down to a variety of things, whether it be funding, whether it be political pieces around planning. But what has the Bon, specifically in Limerick, done in terms of, to a degree, future-proofing the brand new facility?
The building itself it's on 7 acres, and it's just over 250,000 square foot. So yes, when we were designing with our colleagues HOK and Ready, to be fair, I'm going back 4 years ago, when we were designing, at that start-off meeting, we were looking at, okay, when we expand, where should we expand to? Okay. So when we were designing theatres and radiology, which are the more trickier of items to expand, they're right next to a gable wall. Okay. So that if we were to expand, you knock the gable wall, and you're able to expand out quite quickly into another site. So we've got about 70,000 square foot of expansion space within the 7 acres, but I've got a balance talking about phase 2 and phase 3 with get phase 1 open, get phase 1 delivered, to be fair, but I've got to balance that between also trying to bring in some maybe consultants in the future, said, look, right now we've got this, but our plans are to go away, especially critical care. Critical care is really going to become very, very important. If Sláintecare, and I say if, and I'm not close enough to it to understand it fully, but if Sláintecare carries through, and the whole premise that private members won't be treated in a public hospital, private members' needs will expand in terms of more complexity, into cancer care, into more technology and critical care. So we, the private provider, need to also change in line with that.
Sure.
Diversification in terms of where then do you do certain procedures that you just, we're merged with our colleagues in the US, Bon Secours Mercy Health. We merged with them back in 2019, and they're an amalgamation of just over 50 hospitals. And again, we're looking at what's happening in the US market, in the healthcare market, and there are certain elective procedures traditionally done in a hospital setting that will be done now in an ambulatory setting, closer to the patient. I mean, Ireland is a small country, but it's still geographically quite spread out.
Sure.
So diversifying into ambulatory clinics or other diagnostic centres and things like that is nothing new per se, but maybe for the Irish market. So again, looking at things like that. But at the end of the day, our foundation and our bread and butter is to provide hospital services as contracted by our customer.
Yeah.
But at the same time, we know that it's going to become more complex. It's going to become more high tech, and it's then how the insurance companies are going to respond to that. Because at the end of the day, that's who's paying us.
Yeah.
That's what, and we, if people have health insurance, are then probably notice that in terms of their premium, and why is premiums getting higher, etc. Because of the technology developments in equipment, and we've got 2 robotic systems in our hospital. Never thought we would. Yeah. And one of those, like the robotic C-arms, they're not robots going around doing the surgery and that, but they're robotic assisted C-arms with inbuilt enabling technology and mapping software and like.
So is that for particular surgical specialties, or
it would be vascular, interventional vascular.
Okay.
We made the first Bonds hospital with our colleagues, Mr. Eamon Kavanagh and Mr. Tony Maloney, our interventional vascular surgeons, where we were doing interventional vascular. Okay. None of our Bonds hospitals do that at this point in time.
So you might be the envy of the group then, are you?
Yeah, envy might be a strong word.
Okay.
You know, we've a long way to go. We've a long way to go. To be fair, we're humble in Limerick. You know, unlike our colleagues in Cork, they're 112 years old. That hospital.
Okay.
Just to put in the context. You know, to be fair, we're 7-8 years old. You know, and Tralee is only 100 years old. Dublin, over 70 years old. They're at it a long time.
Okay.
A long time, doing some excellent work down there, and in all of our hospitals. So we're learning from them as well. We're picking up items.
Yeah.
So, goes back to my earlier point. Every week it's a learning week, constantly learning. And who also helps us to learn are consultants and medics who come in.
Yeah.
They will challenge you, and they will have, but they also have to balance the fact of the latest technologies and the latest. But that's what you need. You need people coming in saying, we should try this, we should try that, and then work in collaboration as to why we should do it, who's it going to benefit, but we do that together.
Okay.
You know, so it's not me sitting back dreaming ideas. I love when people are around the team. Have you seen this? Should we do that? You know, that's what we've created, I think, inside Barrington's, and that's why I'm proud that everybody's relocating with us. Everybody's making the move.
Okay.
You know, we can't take it for granted. We met all our consultants, we met all our staff, and basically didn't assume that you're going to come out 3-4 miles up the road. All bought in. You know, and just important to look after the existing team.
Sure.
As hiring the new team.
Absolutely.
You know, there's two different categories of that.
And that's a big piece of that culture too. You talk about a mere 3 or 4 miles down the road, but you know, bringing that existing culture and bringing in a whole batch of new people, there's a lot of play there, and you absolutely need to get that right. So let's just say, just back on the recruitment side of things. Yeah. Let's say if you know, we've in Match Medics, we've a growing interest from consultants in the US and the UK and returning Irish. Why Bonds in Limerick? Why should they be looking out west?
The why part will answer itself when they come and visit us. All I ask is come visit us, come meet with myself, with Dr. Siobhan Grimes, clinical director, some of my management team colleagues, walk the hospital. These individuals have worked in enough institutions and hospitals that you can pick up a feel for a place.
Sure.
You know, now says he who doesn't know what the field is yet in Torrington.
Okay.
But I'm confident. And you make a good point about trying to transfer the culture of Barrington's. In a way, it's not Barrington's. Barrington served a purpose. It's now a new facility, but the foundation of respect and collegiality, that's what we bring, but it's going to feel different in a brand new building. I was talking to one of our clinical nurse managers this morning, and on Monday I happened to walk through the endoscopy unit, and we came up with the nurses' station, and it is probably the biggest nurses' station I've ever seen in 30 years. It is phenomenal.
What's the scale we're talking here?
It's as big as this room.
Okay.
Yeah, bigger than this room.
Okay.
But the irony is that same department, Catherine and her colleagues, are gathered around a table smaller than from where you and I are both sitting. That's their existing nurse station.
Right.
They've been doing that for 15 years.
Yeah.
Never complained, got on with it.
Probably know nothing different.
A desk.
Now.
No different. And now they're moving to state-of-the-art, fantastic facility. So it's like, that's going to be a change.
Sure.
You know, and how that impacts. So I very much look forward to how people are going to set. And it's a bit disconcerting when you're moving into a brand new build. The ward is completely different. The ward we've designed with 25 individual single rooms in a curved shape versus one straight corridor and 3 or 4 beds off each side. Completely different.
I guess the beauty of it is, with the existing team and new team, you're all learning this together.
Absolutely.
Absolutely. And I think that's certainly a big draw for someone new coming in, that it's a team effort.
And if you have the people you mentioned earlier about the personality type, some people can be maybe a bit withdrawn about the newness of something, or that they're at the start of something, and some people thrive on want to be part of developing it to go forward. It depends, but you don't need everybody to be innovators and drivers. You need some people too who are quite easy, just behind the scenes, nicely doing what they do as well. So in a roundabout way, back to your very good question, why should you join the Bonds Limerick? If you want to work, if you want to treat lots of patients, and in a facility with a team that is all aligned to look after the patient and make sure that the patient's getting looked after. You can talk about that, you can say that, but you'll experience that. And all I can say is that I've witnessed it, I've heard patients say it, and I've received letters from patients telling me about their experience, etc. We seek feedback from patients. We get very good constructive feedback as well. And there's this thing called like a word cloud, where you get the number of times it's been repeated, the word gets larger.
Sure. Kindness,
professionalism, and things like that. Staff, courtesy. That's what jumps out.
Okay.
And not necessarily clinical competence has the nicest scar I've ever seen in my life. That's a given.
Yeah.
That's a given. It's the other part that comes with that.
Okay. So the additional softer interpersonal piece, the personal piece that really...
Compassionate care.
Yeah.
You know, it's
Okay.
easy to say that, but it's the whole patient treatment, as
Okay.
well as the clinical, very important interventional side, and the medical interventional side is the wider experience.
Yeah. And if you don't get that patient piece right, there's no point being there, is there?
They're
No.
very vulnerable. They
Yeah.
walk in the front door and they hand themselves over literally to you.
Yeah.
You know, you're in there and they just put themselves very openly to say that, and like that's a big responsibility from
100%.
the very, very start, from the reception desk all the way through when they're saying goodbye to the reception, a few hours later or a few days later. That whole journey, that's what it's about.
Okay. Let me ask you a couple of more Irish-themed questions before we wrap up. And again, thanks for taking the time today, Jason. As an Irishman, what myth would you like to bust on Irish people internationally today?
Jesus, you got me there. What myth would I like to burst about Irish people?
About Irish people, yeah. That others overseas might think stereotypically that's Irish.
Why? What? Give me a hint. What do people think we're like?
Pale-skinned, ginger-haired. we're all redheads like myself, or we're all alcoholics. What other stereotype perhaps have you come across, or myth that you come across that you'd like to share with the world?
It's like I suppose like we've, as I said, merged with our American colleagues, and Barrington's building is 200 years old.
Yeah.
And like there is no doubt when the Americans walk through Barrington's, like they are feeling claustrophobic.
Sure.
There's no doubt about that. Going, how can you run a hospital with this size, like a desk like that for the nurses' station, or like? And to us, that's efficiency. We get on with it. But that quite comfortably we can go from that to the most advanced, spacious hospital and feel comfortable in both those.
Okay.
As opposed to maybe them thinking, oh, they're only comfortable when the thing is not as high tech and they'd lose themselves in a high tech environment. We're very adaptable and very comfortable in either environment.
Yeah.
We play the hand we're dealt with, and whatever we're dealt with, whatever comes at us, we'll take it. We'll take it in our stride. I sometimes, like, if an alarm went off, we don't exactly start running straight away.
Yeah.
But if we did see something happening, we're the first to react, and we're the first to jump in, put the sleeves up, and solve it.
Okay.
You know, so don't know is that a myth out there that we would run first from a fire and that we'd run towards it, etc. But yeah, there is no doubt when you meet some of our American colleagues that they're like, how can you do your job if you don't have the size and scale of what you should be doing it in? And we're going, because we can. We just put the seas up and we get on with it.
Yeah.
But we will do it very safely, and we challenge anybody to question our clinical outcomes, absolutely. And the data that we go looking for and continuously seeking. I mean, on that, I suppose to be fair, there's a well-rounded admit, like, we're still on paper.
Yeah.
Like, that is a problem.
Sure.
There's no doubt about that.
Yeah.
And it's not paper per se from a sustainability perspective, which is important, but by going off paper into digital, you're now allowing yourself to start using enabling technology to analyze your data to help you in decision making. You can't do that on paper.
Yeah.
And like none of the Bonds hospitals right now today have an electronic health record.
Okay.
We have an element of it that's paperless in our IPNS PAS system, but now we've partnered with Meditech Expanse out of Boston in the US, our 5 hospitals. Towards the end of this year and into next year, we're now migrating onto a full electronic health record.
Okay.
And that will be a journey over the next couple of years where we begin to optimize that system and start then layering in technology on top of that to extrapolate what is going to be very, very important is patient data, anonymized from a whole GDPR perspective, of course. Patient data, spotting trends, spotting algorithms, etc. People use the phrase AI. Personally, don't like the phrase AI. It's too wide, encompassing. To me, it's enabling technology to allow our clinicians, our nurses, our medics, everybody, to make their job easier, to allow more care to the patient. So that's another. It's not a myth, really. They're right, but it will become a myth over the coming for the Bonds anyway. And indeed, the Children's Hospital are bringing in electronic health record So that are we don't do ourselves favours when there's things like that that we're so behind.
You'd like to think easy fixes, but
we're 2 years now putting in the system in the bonds alongside 5 hospitals. We've got to look at their existing practices and bring in one, I suppose, standardised system. And the word standardisation in healthcare is never a good word when it comes to independent private hospitals. People like to use clinical autonomy and decision making, but it's not standardising clinical decision making, is standardising practices and pathways and admin pathways, etc. So that would be another one that there is no doubt, but I think it's going to be a myth that will be come to the fore very, very quickly. And that should become an attractive feature too for, you have consultants who are abroad right now, you mentioned across the world, guaranteed they're all using electronic health records.
Absolutely, yeah.
They're all, and when they're using them, they're now depending on them as well, so right back to a question I asked 3 questions ago, another reason why you should come to the Bonds and Limerick, who will have an electronic health record. Especially attractive, dare I say, to returning consultants, maybe not so attractive to existing consultants who are very used to doing things a certain way. But again, we need to do a good job on promoting the benefits of moving with this technology.
Absolutely.
And this technology then enables algorithms, etc., to come on top of that to safely look after and improve patient care.
And that technology-driven decision-making is also embedded in that culture.
Absolutely.
I'm going to leave on one final question, if I can. As a Munster man, leaving your Cork allegiances to one side, why should someone move to Limerick?
I have no problem as a Cork man saying this. The culture in the hospital is one thing, but the people of Limerick, working with them. I've worked in, and again I'm going to offend Kerry and Cork people in one failed move, the can-do attitude, the sense of collegiality, but it's amongst departments in the hospital, but it's evident in amongst Limerick as well. I'm a member of the Chamber of Commerce, the Limerick City County Council, open doors. If you're there, no matter who you are, what you do, but if you're there to make Limerick better, to improve health in Limerick, or to improve anything in Limerick, it is what can we do for you? Can't necessarily say I would experience that as openly in anything else where I've worked. And I'm here 8 years now. One or two of my daughters mentioned I'm picking up 1 or 2 Limerick words, which is again slightly worrying, but anyway. The attitude of the Limerick people, the staff in particular, it's such a roll up the sleeves and loyalty and commitment. I haven't experienced it. It's absolutely fantastic.
Amazing. Thanks so much for sharing all things about the Bonds in Limerick. Thanks for taking the journey up to Dublin, particularly with people who can't see, with the boot on your foot, for making the trek up from Limerick.
Not at all. My pleasure.
And showcasing everything that the Bonds has to offer for Limerick and I guess the wider Southwest region.
And thank you for the support as well. Appreciate it.
Thanks, Jason.
Not at all.